How concerned are you about the India variant?
Well, I mean, there's good reason to be concerned, as you've heard. So there's a high degree of confidence that this virus is more transmissible, and a realistic possibility that the increased transmissibility over the current so-called Kent variant, B117, is up to 50% more transmissible. And you've just had a discussion with the health secretary, dissecting those different points. But I mean, there are clearly grounds for concern, but there is substantial uncertainty. And that's been the challenge for policymakers throughout the whole pandemic, which is that they're always having to make decisions in the face of incomplete evidence. The job of the scientists is to present that evidence as clearly as we possibly can.
Matt Hancock said that if it is 50% more transmissible, then there'll be problems.
Yeah.
What would those problems look like?
Well, I mean, the problem will be that the infection will take off, and there'll be very large numbers of infected people, particularly amongst those people that haven't been vaccinated yet, people who are only partially protected because they've had one vaccination. And again, as you've heard, in a small percentage of cases, the vaccination, for whatever reasons, doesn't work. And so whilst it is perfectly true that the vaccines, and it's been a remarkable story, and we've got 2/3 of the adult population with one jab in their arm and half of that number with two jabs approximately, does protect you against severe infection and death. Nevertheless, that isn't complete. And the challenge essentially is that a small fraction of a very large number, that's the people who are potentially infected, gives you a lot of people that could be quite sick.
Given that, do you think it is the right decision to go ahead with Monday's unlocking?
Well, that is the decision that policymakers have to make. It's why it's easier to be the scientific advisor than it is to be the politician. The answer is that I think that you are hearing them all saying, well, please be cautious. And the addition of fresh air to the hands, face and space, I think, is extremely important. That is the most important thing of all at the moment. And the good thing about the time of year, although the weather hasn't been great, is that it is possible to spend much more time outside. And so if you can do things outside, you should. And if you're doing things inside, then make sure the windows are open and it's being properly ventilated.
If fresh air is the most important thing, I understand that it's a decision for politicians. It's difficult for scientists, for members of SAGE. But if fresh air is the most important thing, why are we going ahead with the expansion?
Well, I mean, again, you've been asking Matt Hancock that. Each of us will have our own opinions, but I'm not elected, you're not elected. So, my job is to help let people know what the science actually says. And it's the job, of course, of Patrick Vallance and Chris Whitty to provide that direct advice to ministers. And, it's perfectly clear from the interview with the Secretary of State just now that he's hearing the evidence and he's having to make quite tough decisions in the face of uncertainty. But I think the critical thing at the moment is firstly, that vulnerable people who have not been vaccinated really need to get vaccinated. And that's why it's important that there's these efforts to surge the vaccination to the people that are eligible in places like Bolton and Blackburn and other parts of the country. So that's really important, because if you haven't had a vaccine, you really must have one, actually. There's no good reasons for not. So that's the important thing. But then it is, I think, a question of people making judgments. And, my personal judgment is that I will do things outside as far as possible.
So you're not going to be heading to indoor pub tables, then? You're going to be staying outside?
Outside, I think, for the moment, yes.
You're talking there about the evidence that scientists are presenting to government in which they can then make the decisions. So what does the evidence suggest might happen after Monday's changes? Are we likely to see a rise in infections or hospitalisations?
So the control of this infection still depends on two things. It depends on social distancing, because the virus basically has to transmit by proximity from one person to another, essentially, and the effectiveness of the vaccine. The vaccine program is amazing. It's a tremendous logistic achievement, and it has had a huge impact. But we now have a virus that is even more able to transmit than its predecessors, so it becomes a tougher race. And so, that's the critical issue at the moment.
If you're looking at the sort of SAGE minutes that were published yesterday, which were saying that there is a realistic possibility that the India variant is 50% more transmissible than the Kent variant. And if that's the case, it's likely that progressing with step 3 alone, which is the changes on Monday, would lead to a substantial resurgence of hospitalisations similar to or larger than previous peaks. That's quite shocking, it feels.
Well, I mean, it's a very clear statement, and there's good evidence to back up the statement. But it's why it's going to be extremely important to keep a very, very close eye on the numbers over the next few weeks. And one of the troubles with this pandemic throughout is that there is a gap between someone becoming infected and them ending up in hospital, and then potentially the terrible outcome of them dying or being severely disabled by the disease. And so you're always playing catch up in terms of looking at the numbers. Now, case numbers at the moment nationally are fortunately low. There's about 2,000 cases picked up each day. But we do know, for example, in Bolton, the case numbers are much higher, at just over 200 per 100,000 of the population. In Bedford, there are about 100. So we've really got to keep an eye on the numbers. So test, trace, and isolate is really important. It's critical that people do get tested and do report if they have symptoms and isolate themselves and their families. These are all really important things. And we are going to learn over the next 2 or 3 weeks what the impact of the changes is. And the problem is that the data takes some while to emerge. Which is why there's every grounds to be very cautious about the ability to open up in June. But I mean, I think it's fair to say it is a perilous moment. We have a variant that shows good evidence of being more transmissible and possibly significantly more transmissible. We're going to have to watch the numbers extremely closely. And the other thing that we do know is that this new variant from India is actually quite widely distributed across the country. So we know about the hotspots, but it is in all 4 nations. There's a fair amount of it about, and it is increasing in proportion in terms of when the genomes of the cases looked at. We also know that it's in at least 60 countries around the world. It's in a number of countries across Europe. It's in the United States. And it's doing what previous variants have done, which is that as a fitter variant of the virus emerges, it takes over as the dominant strain around the world. And if you like, the relief with this variant is that the evidence so far suggests that the existing vaccines do protect against the most severe effects of the infection and death. But we still have a certain amount to learn. We don't know how much the vaccines protect against people getting milder infection and their ability to transmit to others. And that's why this constant vigilance is absolutely critical.
You mentioned the June unlocking. Of course, Matt Hancock made it very clear that that is under review.
Sure.
Do you feel that normality has got a little bit further away for us?
Well, possibly. But I think that people have said all along that, this is a very pesky virus. It's very versatile in its ability to, change and evade. That's what viral evolution is all about. And so, complete normality, I think, is going to take a bit of time to return. And people have got to be sensibly cautious, I think.
Sensibly cautious. What would your advice be then for people from Monday? Well,
my advice is that, just because you can do something doesn't necessarily mean you should. As far as possible, socialise outside, maintain social distancing. If you're going to hug cautiously.
How do you hug cautiously?
Well, you don't. Well, without going great demonstrations. Tight clinches should be avoided.